Assalamu alaikum, ladies and gentlemen. Welcome to this installment of CxO Global Forum's show on health tech called Health is Wealth. CxO Global Forum is Pakistan's largest C-level corporate forum, connecting some of the best C-level executives from all over the country from a wide array of high-performing companies, from blue-chip companies to MNCs to SMEs. Today's segment invites a very special guest who actually took the reins of Pakistani healthcare when the first pandemic or the first wave of the COVID-19 pandemic came around. I would just like to give him a very brief introduction. Zafar Mirza is a Pakistani politician who served as a special assistant to the Prime Minister for Health. He was appointed by PM Imran Khan on the 23rd of April 2019, and he was officially in office from the 23rd of April 2019 to the 29th of July 2020, when he decided to step down. Assalamu alaikum, Zafar Saab, kaise hain aap? How are you?
Ji, walaikum salam. I'm very well. Thank you for having me.
No, thank you for gracing us with your presence. Naturally, even though the show is about healthcare technology, all my other shows have had that angle of talking quite extensively about COVID because it's a very, terrifying disease, even with Omicron and the new variant coming around. I actually did a show around 2 weeks ago. For the audience's knowledge, and I'm sure you're very well aware, the WHO reported the first case on the 26th of November 2021, and it actually was deemed a variant of high concern and not a variant of high interest like the Lambda mu variants, which were skipped over. But a person in your position, of course, who is a doctor and who also deals with public health, knows much better how severe this can be. So I'd like to get started with our round of questions, naturally. So my first question is, what has your experience been in the realm of healthcare? Not just in Pakistan, but abroad as well. So you can elaborate on how you've been practicing as a doctor, if you have, and how you've been involved in public health and other domains of health.
Well, thank you very much, Bilal Saab. It's a pleasure speaking with you on this forum, which sounds very interesting. Your question about what my experience is in healthcare is such a broad-ranging question. But I'll speak briefly in bullet points, because now it has been an age that I have spent in healthcare in one capacity or the other. So basically, I'm a graduate of Pakistan's healthcare educational system. I graduated from Rawalpindi Medical College, which is now a university. I was trained and I was very passionate to become a psychiatrist. So I was trained as a psychiatrist for about, and I worked as a psychiatrist for about 3 to 4 years. Then I joined public sector and I worked in rural healthcare in basic health units. Then I also worked as a private specialist in psychiatry for, although it was very brief, but it was very good taste of how
We're having some technical.
So how private healthcare
Appears to be some technical difficulties right now. So we got from Dr. Zafar Mirza that he did aspire to be a psychiatrist and he did work a little bit in the field of psychiatry. I'll just try to get him back on the line.
Hello.
Welcome back. Sorry we lost you there for a bit. So you were talking about psychiatry. That's what we got to hear so far.
Yes, yes. Sorry about that, but it was, I think, a connection problem, and I was kicked out of your studio. I have tried to re-enter. I have worked as a private practitioner as well. Then I established, disgruntled with the healthcare system and the excesses which were being made by different stakeholders. I ended up establishing a civil society organization called Association for Rational Use of Medicines in Pakistan, which later turned out to be evolved into a network for consumer protection. So it was now, with the benefit of the hindsight, I can say that it was a organization ahead of its times in Pakistan. But I think we achieved a lot. I worked there for about 12 years as a founding executive director. From there, I moved on to international civil service, where I joined World Health Organization, and in a blink of eye, I spent about 16 years in World Health Organization. So saw the dynamics of the global health at global level in WHO headquarters in Geneva, at the regional level in Eastern Mediterranean Regional Office of WHO. I worked there in capacities of regional advisor on essential medicines. I led a team on public health innovation and intellectual property. Ended up also as a director health system development in Eastern Mediterranean Regional Office, where I was responsible for about 22 countries. And sitting there in a meeting one day, I received a call from the Prime Minister of Pakistan, who, to cut a long story short, invited me to join his cabinet. I don't know why. Who told him about me? It is still a mystery to me. And I ended up sitting in the federal cabinet of Pakistan. Within 36 hours, I was in Islamabad after his call. Served for about, I think, 18 months as a health minister. Then when I resigned, there were many options available, but I decided to continue now to stay in Pakistan and settle down here and continue with many unfinished agendas, which I see as unfinished agendas in healthcare in Pakistan. In further questions, we will elaborate more a little bit on my passions in healthcare. But to give you these bullet points is to actually establish the range of experience that I had as a young doctor in Pakistan, as an activist in health, when I established my civil society organization, as a actor in global health, representing WHO, working in public sector back in home as a minister, and now engaged in number of projects. So just to give you an idea that I think that I know a little bit about this space.
Well, that was a very comprehensive reply, and it just shows that you chose this path that led you to where you are today. And coming to that, right now we go into naturally asking you about how your role as the SCPM of health turned out to be. And I know you don't like broad-ended questions, so if I really were to, I guess, cut to a specific question upon that, it would have to do with you talking about one or two particular issues that you helped manage and solve during your time as SCPM of health. So these are issues that essentially the government knew very well about and called upon you to fix. And how did you fix them, and are those positive repercussions still there to this day?
Okay. Thank you for asking me. I'll as you said, because of shortage of time, I'll just pick few of those which I consider as very important contributions I consider that I was able to make. First and foremost, Bilal, it was to establish the idea of universal health coverage in public policy, and to bring people around it, and to speak about it in the federal cabinet, and to sort of help evolve the vision that already existed for better healthcare in Pakistan, which our Prime Minister is very keen about. His route to, as you know, politics is through health and cricket and health, you can say. And he was very keen, he is very keen about improving health conditions in Pakistan. But I think help evolve that idea into the idea of universal health coverage, where everybody have access to essential, and this word is very important, essential healthcare, regardless of who they are, uh, where they live, what they believe in, what color of skin they have, what gender they belong to, what beliefs they have. But everybody has a right to a certain level of healthcare, which is a state's responsibility, and state need to organize its resources and its healthcare system in order to be able to deliver that to the people. So, and within the universal health coverage idea, which is now very well trenched in our national health policy, in our whatever we talk about, it actually is embedded now in universal health coverage. Whether it is our national health strategy, whether it is our 5-year development plan, it is universal health coverage everybody is talking about. And within universal health coverage, I think I contributed in a humble way the importance of the primary health care, because primary health care is the linchpin of national healthcare systems. If at all, anywhere in the world, a developing or developed country has been able to improve the health conditions for its people, it is through primary health care and not through big tertiary level hospitals. The health indicators do not change, whether it is infant mortality rate or maternal mortality rate or life expectancy or you name it. These indicators do not change through big hospitals in big cities. They change through healthcare, essential healthcare, which is provided at the doorsteps of the people at primary healthcare level. The healthcare system research now tells us that more than 70% of all health services can be provided at primary healthcare level. So I think I contributed to establish the idea of primary health care in the policy minds of this country at federal level and at provincial level. And if you see today what kind of reforms are being taken in provinces as well as at federal level, they are all around the idea of universal health coverage and primary health care. So these are very macro level, I think, contributions that I made. Um, then within this, when we talk about essential health care, obviously then we talk about essential health services. What are those essential health services? For the first time in the history of Pakistan, I led a very robust and rigorous exercise spanned over 2 years, which resulted in a national essential package of health services, which is costed, which is cost effective, which is a product of wide ranging consultations across the country. And now it is published and available on the website of Federal National Health Ministry of National Health Service Regulation and Coordination. Along with that, those who cannot pay, the idea of social health insurance, which is being unfolded in Pakistan over the last couple of years, is this Sehat Sahulat program. I don't claim that I introduced it, but I definitely contributed in its evolution in the right direction, which means that vulnerable sections should become a priority. Poor were already a priority here. But what I really take pride in is that I raised the discourse on vulnerable populations beyond poverty. So I was other day speaking in a meeting, and I said that if somebody asked me that what is the most important thing you did. So among the most important things that I did was to actually extend social health insurance to all disabled people in Pakistan. Number one. And number two, extend this Sehat Sahulat program or this social health insurance program to transgender community in Pakistan as vulnerable of the vulnerable of the country. Um, Another thing which I think that it can be, if you tomorrow write my obituary, you will add that to the list, and that would be um that I was instrumental to make a case and then implement it, and that is a switch from conventional disposable syringe to a auto destruct syringe. This is such a phenomenal change in our healthcare system, which will avoid uh, hundreds and thousands of deaths um, due to contaminated syringes, whether it is hepatitis C or B or HIV/AIDS. This was not easy, as you would imagine, but we were able to do this, and now it is being implemented. So the list goes on and on, but you have a short time, so I will stop here. But these are a couple of those things which I think that I can say that I contributed my 2 pence.
So the just a quick question because I belong to a pharmacy background. Do you get insulin syringes in auto disrupt form as well or not?
Sorry.
Do you also get insulin syringes in auto disrupt form?
They are already, I think most of them are in auto destruct form. Um, to me, except a very small number of disposable syringes which are not auto destruct, which are needed in our system because of certain specific needs. I think 99% syringes should be auto destruct in low and middle income countries where otherwise the infection prevention and control systems are very weak. This is one major factor. And this was all triggered because of Ladkana epidemic of HIV/AIDS among children, where I personally went and I observed what happened there and how people were affected and what caused it, that misery. And ultimately, we came to this conclusion that it was basically the repeated use of conventional syringes, which were basically infecting young children by GPs, by quacks, by different kinds of practitioners there. And I picked that up and transformed into a national program for switching from conventional syringe to auto destruct syringe. We have
That's quite
16 manufacturers of we have 16 manufacturers of syringes in Pakistan. My last count was more than 10 had already switched their manufacturing from conventional syringe to auto destruct. This is not a small step in a country like Pakistan,
of
which has
course.
so many governance problems and so many interest groups and so many lobbies when it comes to commercial interests, that people fight tooth and nail to protect their commercial interests, and yet we were able to manage this. But we also incentivized, we also facilitated the manufacturers and the importers, etc. We have more than 100 importers of syringes. All of them are now switching to auto destruct syringes. Over to you.
That's quite encouraging, and that's quite big step in the right direction, actually. So my next question
Yeah.
specifically has to do with the COVID-19 pandemic, and It is my understanding that you were SAPM Health during the first wave when it hit Pakistan. And I do recall when the first case was detected in Pakistan, Javed Akram held a very big symposium at the University of Health Sciences, which I ended up attending. And I don't think anyone could have foreseen at the time how severe this virus actually became. So I just wanted you to briefly elaborate on how it was, detected over here, what measures were taken by the government, and just a little bit about what your thoughts about how Omicron will fare as a new variant of COVID.
Hmm. All right. Um, Again, the preparedness and ability to respond to public health emergencies, including epidemics, is built when there are no epidemics. And since in most developing countries, including Pakistan, we do not consider this important unless we are hit by an emergency, we were very ill prepared when COVID came to Pakistan. But being a public health person myself and having benefit of few very accomplished epidemiologists in the country, we I think we foresaw it uh, when it was quite far from Pakistan, and we started building our defenses. Which means that, if I remember correctly, I called first meeting of all chief secretaries and health ministers um, when there was no case in Pakistan on COVID-19, and this was around 15th of January 2019. And I also invited all the important experts, infectious disease specialists, epidemiologists, and we started discussing and started monitoring the situation. So, in the hindsight, if one writes the story about Pakistan's response to COVID 19, one of the factors which will emerge and stand out would be an early start. So in Pakistan, we were doing things which Canada and America were doing a month later. And this is not exaggeration because this has been accepted by these countries and WHO. At one stage, World Health Organization shortlisted 7 countries, and Dr. Tedros, who is the Director General of WHO, he said that if we have to learn how to deal with global pandemic at national level, these are the 7 countries we should learn from, and one of them was Pakistan. Great credit, I think. Kudos to everybody who was working on this. I remember. Anyway, so to cut it short, basically, at that time, our whole effort was to stop the virus entering Pakistan. And for that, we worked on 17 point of entries, 18 point of entries, which we have in the country. But more importantly, the airports, but also seaports, as well as road borders on land. So I think, and then we coordinated it very well with China. Because it emerged from China. At that point, there were only cases in China. Gradually, Iran got burnt, and they had almost a tide of patients of COVID-19. But starting on 15th of January, we had our first case declared diagnosed in Pakistan on 26th of February. So this was the time period during which we raised our guards, we strengthened our defenses, and we started having a daily meeting at that time. And then gradually it evolved into ultimately what we know today as NCOC, National Command and Operation Center. We called, I counseled Prime Minister that we need to actually call a National Security Committee meeting because it is a security issue. So all leaders, all chief ministers, heads of armed forces, navy, air force, um, all chief secretaries are part of the National Security Committee, and we discussed it there. And this is how, and there were a lot of difficulties as well. There were mindsets that no, koi masla nahi hai. It is not a problem. We will overcome this. This is all Western, propaganda and all that. Those kind of things. I remembered once when I raised the point about making mask wearing mandatory, I was laughed at in the federal cabinet. But the same cabinet colleagues later were gracious enough to say that I was somebody who was alarming at that early stage that we need to do this. Uh, at a macro level, I think that Pakistan has done very well in COVID-19, given our resources, given our state of governance, given our administrative structure of the country. We are federation with constituent units who are very autonomous, and it is not easy to develop a national response when you have autonomous federating units. But we managed that, and I give a lot of credit to NCOC for this, uh, which was established and civil military administration worked together, and we unbelievably efficiently worked. We were data driven. We improved our disease surveillance. We improved our testing capacity. We improved our access to, at that time, whatever drugs were being, um were being made available as remedy, remdesivir and others. But when vaccine came, then I think NCOC has phenomenally done well in terms of accessing these vaccines by being a non-vaccine producing country, yet being able to fully vaccinate around about 55 million people by now is not a joke. And people now do not understand this, that what kinds of difficulties government would have faced to get access to such large number of vaccines, and how difficult it can be when there is a competitive environment in global health. Everybody wants those vaccines. um, so the system in this time for COVID-19 has actually worked very well, and people are already writing about it. There was a recent article in Dawn which basically draw parallels between our COVID response and the working of NCOC with the overall governance in Pakistan, and what lessons can be learned to improve Pakistan's governance with reference to the working of NCOC. As for Omicron is concerned, this is definitely a new challenge. The transmissibility now has been proven very high. The disease causing potential of the virus is not that strong, fortunately, especially among vaccinated people. So somebody has even called it that the new wave due to Omicron is a pandemic of among unvaccinated people. So I think it further highlights the importance of vaccination, and it also reminds us that it's not yet over. Um, and it also reminds us about areas of still weaknesses in our system. For example, our genetic surveillance and mapping of the virus is not that strong. and there may be more variables coming up in future. So I think all in all, now we have developed good reflexes, if I may call that, for dealing with the epidemic. We have started learning to live with it. Um, the only, I think, the challenge, in my view, at this point, which must be emphasized more than anything else, is vaccination. People should get vaccinated. Those who are still not vaccinated must get vaccinated. Those who still don't believe that they should get vaccinated should get vaccinated. Those who have taken both doses 6 months ago and 6 months have passed, they should get a booster. And I think everybody who understands this has a responsibility, as a civic responsibility, as a national responsibility, to convince others who are not still convinced that they should get vaccinated. That is the defense. That is going to be the defense against this pandemic in future.
Yeah, that definitely adds up. And I keep telling people, right, when people have doubts about whether to get vaccinated or not, or whether vaccines actually, despite the fact that you might find an anomaly of a statistic saying that, oh, 1 out of 1,000 people who get vaccinated end up getting hospitalized and dying. You examine, and I'm sure you're familiar with this particular metric called the R dot, the R subscript zero of a disease. And with the flu, it was around 1.5. With COVID, it varied from 1.8 to 2.1. But chickenpox, actually, in essence, has an R dot of 12. That means, just after a couple of rounds, it affects potentially tens of thousands of people. But the reason why chickenpox is not a concern today, people actually don't contract it, is because of the vaccine. But then again, right,
Absolutely.
I do feel that issues in healthcare often stem from a lot of times people being ignorant about the diseases. I think now we have greater access to all this content and fact check content online, especially from websites like WebMD, where people can find out certain facts and figures about disease that maybe was not that easy to do, say back in the 70s and 80s. Like, I'm sure you can probably recall people had certain misconceptions even about HIV, that you could get it from shaking
Yeah.
someone's hand. That was proven. You just had to talk to a doctor and said, no, it's clearly something that's transmitted to bodily fluids. So
Yeah, absolutely.
and the next question, I guess I'd like to ask and potentially conclude with has to do with healthcare technology, because the show is in essence a health tech show. So it's going to be a combination of two questions in one. Number one, how would you feel the use of technology has helped Pakistan healthcare wise from, I mean, I was going to ask you about how it's been effective in the past two regimes of the government, but specifically during your time. And generally, what kind of health tech has fascinated you in general that you feel should be implemented in Pakistan? In fact, I'd like to make one comment. You mentioned Dawn, and I did read your column in Dawn about the kickbacks doctors get. And ultimately, right, coming from the health tech industry, there is a lot of hesitance from doctors to even use health tech solutions because they feel that it will open up a lot of doors into how they conduct business. And traditionally, right, it's not just in Pakistan, it's all over the world. Kickbacks are what essentially have fueled the pharmaceutical industry, and doctors have been naturally the biggest influencers of that. So I'd like to, just wanted to put that in there with that angle. And essentially, like, that could also be something that you could briefly answer that. Can you see this particular dark side of healthcare also coming to an end anytime soon with the acceptance of health tech?
Um, well, first of all, I think a modern healthcare system is incomplete without technology. And technology has revolutionized healthcare. So there are no two views about it. And hundreds and thousands of examples can be given for that. Um, Having said this, I think when commercial interest gets involved in healthcare, it is by default cause problems. Um, and it is obviously, this phenomena is not limited to Pakistan, it is not limited to few countries, it is a global phenomenon. It is like, maybe it's not a good example, but you see, tobacco. Everybody knows that it causes cancer, and yet it is a legitimate product. It is under the under the legal framework.
Even though New Zealand is
We are
trying to ban it, actually. I think you've read the news for future generations.
sorry.
I have said that New Zealand is an example of a country that's trying to ban cigarette sales for the future.
Yeah, yeah. So the point is that we there is a big body of knowledge now which looks at the medicalization of health, and this is, I think, a very interesting perspective. We sometimes over medicalize health, and the appropriate use of technology, whereas it is a blessing, the inappropriate use of technology is a curse. And obviously, the supply side of health technology always would like to have better business, and better business means more use of their technology, whether it is needed or not. And it is, the healthcare sector is such that there is an agency relationship, as we call it, agency, and that agency is medical profession, which sits between the supply side and the demand side, and can play a very important role in terms of appropriate or inappropriate use of technology because of the differences in the understanding and the information about health, about by patients. So unfortunately, although it is very understandable that the supply side has corrupted the medical profession, and the inappropriate use takes place through them. So the supply side very well know that where to invest. And I think we should be frank about it. We are not talking about something which is not known, which is not obvious, which is not observed every day, everywhere. So that's a very sad part of it. Now, how to control it? Better regulation, better accountability, better transparency. And countries have shown that if such measures are put in place, things can improve. They can still not be finished at all, but things can improve. Now, you also, part of your question was also that what I have liked, or what has inspired me, something like this you asked in terms of health technology.
Jay, yeah.
I think the idea of innovation in technology is zabardast. It is great because innovation takes place to address the need. Innovation does not take place just to sell more. The very idea by default of innovating in health technology is that there is an unaddressed need, and by using technology or by innovating technology, you can address that need. And I think that sort of equation is very fundamental to health technology innovation. I have spent a couple of years in leading WHO team on public health, innovation, and intellectual property. And we also started promoting health technology innovation. So there are many technologies which have transformed completely the suffering Apart from medicines and vaccines, which are obvious, obviously they have made a great difference. But particularly, I liked, for example, you asked me about an example. Um, there was a Canadian initiative through which the iron deficiency anemia in Southeast Asian countries was addressed through a iron fish. This was a technology. It was a iron fish which was developed and which they used in cooking pots. Mothers will use them in cooking pots, and it was made like this that there will be iron which will be actually dissolved in the food, and mothers and children will take that food, and it improved the hemoglobin level, and it improved it addressed the iron deficiency anemia and completely eradicated it. And it was such a simple and such a cheap innovation which helped address such a major problem. So I give this example also because I think it is very important that technology should be simple. It should address a particular need, and it should uh, help address a public health problem, and it should be affordable. So I think that is one great example, but there are hundreds of. I mean, this is this space has erupted with new and new technologies, some of which are just incremental improvements in the existing technologies, and some of them are altogether new technologies. So in this context, I think the Grand Challenges initiative, which was taken in Canada again, and which has actually inspired many governments to set up their own health innovation funds. It was also one of the ideas that I wanted to work in Pakistan to create a health innovation fund in order to incentivize innovators, so that they can you raise a challenge, there is a public health challenge, and you ask people to come up with technological solutions for that. And this has worked, and this has done wonders in some of the countries. um, but in Pakistan, I think technology is a very, very disorganized, unregulated uh, sector, being pushed through medical profession upon patients, whether technology is needed or not, and that that has to change. Other very important thing, and I started working on this as well. We completed a policy on medicines, which I think needs to be now announced, um, and that is that we have not actually given policy direction from government to the technology producers and manufacturers and importers. So the result is, and I think COVID-19 is a great example, which helped me illustrate this point, what I'm saying. So we are hit by a global pandemic. We don't make ventilators. We don't make vaccines. We don't make even personal protection equipment. There are many essential medicines, if we talk about pharmaceuticals, which are not being manufactured in Pakistan, and which are still the number one, choice by good doctors to treat those problems. And yet, market is full of thousands of new and new and new medicines. So this is where the role of state and the regulatory authorities come, that they they give a policy direction to the manufacturers. Another example, Pakistan is the fifth largest country in the world population wise now. Our population growth rate is more than 2. Our total infertility rate in Pakistan is 3.6, and average childbearing a woman of childbearing age has 3.6 children, and our resources are not enough to meet the needs of such big population, and we have completely failed in controlling this.
That's all family
Now, when we
planning.
talk about yes, and when we talk about, for example, the use of technology here, 50% of our districts have stockouts of contraceptives. There is not a single company in Pakistan which is producing condoms, for example. There is not a single company in Pakistan which is producing IUDs, intrauterine device. Most of our contraceptives in terms of pills are coming from abroad. So, shouldn't it be a priority in the country for local manufacturing of these products? And yet you find introduction and launching of very sophisticated new molecules and medicines, and you spend God knows how much money in convening conferences and taking doctors outside Pakistan on, and all that what goes on. We have not been able to put a appropriate framework to health technology in Pakistan.
That's
Government
quite
has
important.
failed.
Yeah.
Government has failed by in terms of directing and giving policy direction that what must be manufactured, and if you manufacture this, we will incentivize you as
Yes.
private sector.
Naturally. So,
And on the other hand, so the result is that we have become a net importer of many essential medicines and health technologies, um, whereas we have fifth largest internal market in Pakistan. But since government has not prioritized those things and we have not given policy direction to the manufacturers, so manufacturers are after, or importers are after quick buck from wherever they can make it,
mm,
and they will
mm,
continue to do this.
yeah.
And highly
So thank you.
unregulated. I'm
Yeah.
sorry to
So
say.
thank you so much for coming on the show, Dr. Zafar. It was a pleasure, and it was quite insightful to hear all this from you. And hopefully, I'll see you again.
All right. Thank you very much for having me.
You're welcome. The office.
The office.